Have you ever come across paresthesia or numbness after third molar extraction? It could be as a result of inferior alveolar nerve injury during extraction. Today, I am going to teach you how to predict nerve injury before extraction with the help of panoramic as well as cone beam CT images. Welcome to Diagnox. The inferior alveolar canal is the bony canal which runs within the body of mandible, which transmits inferior alveolar nerves as well as vessels. It starts from the lingual aspect of ramus as mandibular foramen and it exits buccally as mental foramen. There is a lot of variation in the position of mandibular foramen as well as mental foramen, which we are not going to discuss today. We are just going to discuss the association of inferior alveolar canal with mandibular third molar. Even though the inferior alveolar canal is related to mandibular first and second molar, but they are positioned far away from the inferior alveolar canal, whereas the root end region of third molar is very close to the inferior alveolar canal, and most often the third molars are extracted because they are impacted and they may pose pain during the course of entire life. So today I am going to teach you few radiologic signs, especially with the help of 2D radiographs like panoramic radiograph, which tells us that this particular patient has got an increased risk of inferior alveolar canal nerve injury resulting in paresthesias, so that we have to be very cautious to this particular patient. We may have to take a cone beam CT if you see certain signs which I am going to teach you today. And there are many signs, but I am going to discuss only four important signs, four important radiologic signs that can predict nerve injury, that can predict paresthesia. And the first important sign is darkening of root. If you could appreciate the root end region of this impacted third molar, the tooth number is 38. The root end region is dark. If you could appreciate darkening of root close to inferior alveolar canal in panoramic radiograph, it is an important sign that there is a possible nerve injury. And the second sign is narrowing of canal. The inferior alveolar canal has got two parts. One is the superior cortex, two is the inferior cortex, which appears as a white line. And if you are appreciating a narrowing of canal as seen in this particular case, in this particular region the canal appears narrow, there is an important or there is a probable strong association between root end and the inferior alveolar canal. And the third important radiologic sign is loss of cortex. Usually the superior cortex, which is close to the root end region, if it's lost, if you're not seeing it clearly, there is a probable association of inferior alveolar canal to the root. And the last and the fourth radiologic sign is deviation of canal. If you see the canal comes smoothly like this, when it comes to the root end region, the canal deviates slightly and goes towards this region. So deviation of inferior alveolar canal can strongly suggest nerve injury during extraction. So I would also be showing you the position of inferior alveolar canal with the help of cone beam computed tomography. So this is a panoramic reconstructed view of a patient with impacted third molar. You can see that the inferior alveolar canal is just running over the roots of mandibular third molar. And in this particular case, there were no other radiologic signs like darkening of root, darkening of canal, narrowing of root, etc. This is an ideal case which is indicated for cone beam CT because panoramic radiograph usually doesn't provide details on the buccolingual position of inferior alveolar canal, which definitely can be seen with the help of cone beam CT. And regarding the position of inferior alveolar canal, that's the buccolingual position of inferior alveolar canal. Inferior alveolar canal in the third molar region runs lingually and it slowly moves on to the buccal aspect, and in the mental foramen region it runs or it turns and opens buccally. And in the last 10 years, seeing many patients cone beam CT finding, I have seen very minimal cases where the inferior alveolar canal runs buccally with respect to mandibular third molars. Very few cases. And let's go into the further slices and evaluate whether the inferior alveolar canal in this particular case is running buccally or lingually, and we would also assess whether there is a relationship between inferior alveolar canal and the root end region. So I would move on to the coronal slice at first, and now I am assessing the mesial root of mandibular third molar, and you can see the inferior alveolar canal is definitely present on the lingual aspect. This is the buccal cortex, this is the lingual cortex, and the inferior alveolar canal is in contact with the mid root region. And you can also look at the gross carious lesion in the coronal aspect with pulp involvement, and the inferior alveolar canal in the lingual aspect with close contact to the roots. I would also be showing you the sagittal slice where you can see the position of inferior alveolar canal in the mid root level. I would also be showing you the 3D reconstructed view where you can see the lingual position of inferior alveolar canal in the mid root level with close contact to the root. And this is an important case where cone beam CT definitely gives us many information regarding the position of inferior alveolar canal and its contact with the root end region. And we also can explain these details to the patient, and we can also inform the patient that there is a possibility for nerve damage in this particular case after surgical removal of impacted third molar. Stay tuned to Diagnostics to visualize many more interesting cases, interesting informations regarding cone beam CT, regarding implant planning, TMJ, etc.